Good afternoon, everyone, and welcome to today's webinar entitled Streamline Document Workflows for Better Patient Experience and Healthier Revenue. My name is Mark Haglund, and I'm Editor-in-Chief of Healthcare Innovation. Today's program is sponsored by Foxit. Thank you very much to our friends at Foxit and to you in our audience for giving us your time and attention today. Before we get started, I have just a few housekeeping details to share with you. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILivewebinar. Thank you. At this time, it's my pleasure to introduce our speakers for today's program. Didi Cato is Vice President of Corporate Marketing for Foxit. She has over 20 years' experience in product management and product marketing for large technology companies focused on solutions, support, or ERP solutions, and large-scale commercial off-the-shelf software installations in both the public sector and private industries. Karsten Heyermann is Global President of Fox's Enterprise Automation Business Unit and Chief Evangelist. Beginning in 1995, Karsten was founder and CEO of the Luratech Group, which was acquired by Foxit in 2015, where he had led Foxit Europe's organization as CEO. Since 1995, he has concerned himself with topics connected with compression, standardization, and electronic document capture and conversion. Welcome. Debashri Sarkar is Product Marketing Manager in the Healthcare and Life Sciences unit at Foxit Software. She's a creative, dynamic, and performance-driven marketing professional with 10 plus years of B2B technology experience. And working for both cutting-edge startups and multi-billion-dollar organizations, she has acquired a passion for demonstrating solution value and driving revenue through strategic marketing campaigns. So, Didi, Karsten, and Debashri, welcome to all three of you. Thank you for being with us today.
Thanks for having us.
Great. So let me begin by doing a little bit of level setting around the landscape. What does the current landscape of documentation and working with documents look like at this moment in U.S. healthcare? Didi, what are your thoughts on this?
Yeah, thanks, Mark. That's a great question. You know, documentation within healthcare is really one of the most critical vehicles for, conveying essential clinical information about a patient's diagnosis, treatment, and also their outcomes, right? So documents are also used in communicating between healthcare employees, right, between various institutions and healthcare systems, and especially between clinicians and payers. So documenting the patient records is really important. You need to be efficient and it has to be secure. Those are the most critical things. But, and it's more important now more than ever, right? Especially given in today's healthcare landscape where the government ties reimbursements to the quality of medical records. Medical institutions across the globe have, they've begun to look closely at their document-based processes, evaluating, the most effective solutions for tracking electronic medical records, billing activity, and test results. One of the most common misconceptions for a healthcare organization is to assume that if they've embraced the use of electronic medical records or EMRs, right, or completed their electronic health record conversion, that they have completed the steps necessary to go paperless. But really, the reality is much more complicated. while EHRs are, they're the most significant step towards going paperless, most organizations still manage volumes of paper, which prevent the establishment from, truly integrating, the care team, one in which all information is available to providers in near real time.
Absolutely. Debashri, do you have any thoughts you'd like to add?
Yes. So Didi really mentioned really good points actually about how these healthcare documents are so important. They contain wealth of data, and because even though there are a lot of EHR and EMR system being used in the healthcare organization and on all these reforms, but there are still excessive paper, floating around in the, the healthcare industry. And because of this, the healthcare organizations have not really been able to get all the benefits of going paperless. Also, like there is excessive printing of papers, whether it's for sharing information to third party or just collaborating within the organization. There's a lot of excessive printing going on in healthcare workplace, and which is very time consuming, frustrating, and very wasteful, and it increases a lot of cost. And all these paper-based processes have really slowed down a lot of process which require consent and approval. And also all the processes that are especially patient-facing, the patient experience has really been affected because of this. So what we have realized and what we hear from our customers is that the healthcare industry right now is experiencing this need to level up their document productivity solutions to improve their daily operations and workflows that feature these interconnected systems with proper documentation protocols and e-signatures as a priority.
Absolutely. And so I'll ask all three of you, why has it turned out to be such a complex shift towards quote unquote paperlessness that's not really fully paperless? So whoever would like to comment.
Yeah, I can take that question. It's a very good question, actually. So with all these talks about, the digital first and all the reforms, the government reforms, and also all the initiatives that have been taken, the organization level with the adoption of all the digital technologies, the benefits of someone would think that why, the healthcare organizations are not going completely paperless. You still see paper-based processes. And there are multiple reasons for that, and that the healthcare organizations are not completely paperless. There's an age-old saying that old habits die hard. So people basically prefer paper documents, and this is generally because they don't feel comfortable learning new technologies, and they're very much used to printing out papers and paper-based processes. Well, this is not a very big issue. This can definitely be overcome, and healthcare organization, once they actually know the benefits of going completely paperless, and healthcare organizations have started to realize that, and the healthcare IT leaders are trying to digitize their processes, trying to adopt electronic documentations. Another issue that I can think of is the decade-old documentations that the healthcare organizations have, and converting them to a digital format is a very big task, and this makes it difficult for the healthcare IT leaders to find solutions that meet all their organizational needs with these various document workflows. And also these healthcare organizations receive documents in various formats, and converting these formats to a standard format is another big challenge, and which, this might seem like a drawback to go paperless, but actually in reality, a good document productivity solution software should actually be able to handle these different kinds of document types. Also, healthcare organizations believe that, adopting these digital tools, these digital solutions are very costly for them. It's a very costly process, especially for smaller and mid-sized organizations. From our experience, they believe that going entirely paperless would be a very costly affair, and they try to adopt a more hybrid format in order to save money. But what they don't realize is that this is an ongoing cost. The cost of paper is ongoing. It also affects the experience of the internal employees themselves. Working with paper is a very tedious process. It is, it affects their internal productivity. And also, again, the patient experience is in turn affected. And there is also a lot of revenue losses because of this.
Excellent points. Would anyone else like to add to that?
Yeah, so basically, it's not just the cost reduction with the elimination of paper, but there's many more benefits to going paperless by adopting electronic documents and adopting productivity tools. Right. For example, cutting down, as Debashri mentioned, cutting down on manual keying of data from paper documents right into medical systems. And, paper-based data record recording methods, it greatly lowers the amount of time spent inputting patient data. Otherwise, that's very valuable time, and they could be spending time with patients instead, right? So this also improves, as Debashri mentioned, the employee experience, as it reduces their burnout, right, and improves their efficiency. Once data is digitized, it can be shared much more readily with other facilities, specialists, and with patients themselves, right? It opens the door for initiatives like clinical collaboration, allowing a facility to collaborate with other caregivers who have previously worked with their patients, or, even specialists, right, who can deliver care tailored to that patient's condition. In addition, there's increased collaboration within the healthcare staff, right? Also, one of the most significant benefits is, and we hear this all the time from our customers, is that when they standardize with a solution like ours to digitize their document-based business processes, they're able to increase revenue with better collaboration with healthcare payer organizations, accurately and timely. So digitization of data also provides more clarity in the data gathered.
Yeah, great points, Didi. I'm glad you introduced the concept of benefits. Kirsten and Debashri, would you like to talk about benefits also?
Sure. Actually, Didi, those were really amazing points. And actually, that goes with, those points are really amazing because they go with this employee experience and also how that affects the overall revenue and productivity within healthcare organizations. Apart from that, one significant benefit is of going paperless is definitely, conforming with HIPAA compliance. HIPAA is very important within healthcare, and healthcare documents contain these protected health information that we call as PHI, and HIPAA requires the protection of these PHI. So therefore, compared to the paper documents, sharing healthcare documents that contain these PHI are more secure when they are in an electronic format. So we all hear about healthcare organizations always prioritizing the patient experience. It is a topmost priority for them. So digital technologies, they improve the patient experience because, they don't have to deal with a lot of papers, and, their information is protected. So all the other industries are providing, today, like all the other, like the retail and all the other industries, they are now providing these top-notch digital experience to their consumers. And it is really a time for healthcare to now, give that great digital experience to its consumer and bring about that very much talked about consumerization in healthcare.
Terrific. Carsten, I'm sure you have some thoughts also on benefits.
Yeah, obviously. Probably with my background as an engineer, I'm supposed to give the very technical answer here, and I was about to do something about the security of personal identifiable information being better than in the paper area, like Debashri mentioned, and because of all these technical aspects. I'm going to save that because I have to say something very important. I went to a medical facility this morning, right? I had the experience firsthand. And what happened, actually, I thought it's a high-tech facility, and I had to go there for some tests. And then I was at the front desk, and they signed me up for the examination and stuff like that. And all of a sudden, I was presented with a ton of printed paper that I had to sign on paper, believe it or not. All of a sudden, I was thinking, is there medical stuff as much behind as their front desk? You know, what I'm talking about is patient experience, right? To have presented at the front desk like a seamless end-to-end digital process. And they do have electronic health records in this facility, right? But then they have this break-in system, print out for signature, scan in, have this fancy self-scanning pencil, stuff like that. But that's also old school. Wouldn't it be nice to have the screen turned around? You put your signature on that, and this is your consent, right? So sorry for the non-technical answer, but I really had to get this off my heart.
No, I think that's important, Carsten, and it's very interesting because I just saw a presentation about digitization in Germany and how the German federal government has decided to really move forward to make things more digital in Germany. And it's interesting for me as an American because European health systems in certain ways are ahead of us and in certain ways are behind. But what I think everyone is realizing is that now is the time in all countries. We can't be sitting under mountains of paper any longer. It's as I like to say, it's 2021, people. So anyway, let's talk about next key learnings. What have been some of the key learnings on the part of clinicians and other healthcare staff and workers regarding paper documents that we should understand, the learnings we should understand that are needed to help create a smooth transition to paperlessness? I think, Didi, why don't I turn to you first, and then everyone else can respond.
Sure. Yeah, that's a great question. In order to have a seamless transition, basically, hassle-free to an electronic document format, the first thing for healthcare IT leaders is to understand, all of the requirements of the document-driven business process within their organization. What is it that is lacking in their current document productivity solution that's causing adoption issues? For example, do they need an ESign solution, or do they need integration with a document management solution? A proper understanding of all these requirements determines which digital solution provider the organization should adopt to make their process more efficient and seamless. Another critical aspect is how user-friendly is the tool, right? Or is the solution. Having an interface that's maybe familiar to other tools, such as Microsoft Office, that makes the adoption hassle-free as well, right? Employees don't feel the burden of learning new technology. So again, choosing the right technology, the right partner will make the process for healthcare organizations seamless.
Debashri and Carsten, do you have thoughts about the question around learnings?
No, I think it's Didi covered up all the points. Actually, she mentioned very good points where when it comes to employees not finding it a burden to learn new technologies. So partnering with a solution provider who can actually handhold the employees through the process of digitization, the complete process of adopting a new technology, I think is very important. Also very important is to understand how your documentation, how the end users are using, the documentation, how their workflow looks like, and how would they benefit from using any, whether it's EMR or EHR technology, or if it is a PDF editor technology, how are they using it? And what are the requirements? Like Didi mentioned, do they need a ESign integration? So these are very important points. And I think, from our experience, we realize that this is going to be a very good, these are going to be very important points for a hassle-free transition to adopting electronic documentations.
Yeah, let me just quickly add a shout out to all the healthcare workers out there and give an encouragement, right? We stated all that working with paper document is tedious, and every healthcare worker out there knows that, right? On the other hand, we all have to understand that change is also very difficult, right? And I just want to encourage those people out there and say, yeah, there is change, definitely. But from the experience we have with our customers in the healthcare industry, we can say that after a certain period of change, life is much easier. That's what I want to bring across. So here's my encouragement. Go for it, guys. Don't be against it. It will definitely ease your day.
Absolutely. Great point, Carsten. Thank you so much. What elements of the HIPAA rule set do people need to understand in order to really proceed successfully? Why don't I begin with you, Debashri, on that question?
Yeah, thanks for the question. So HIPAA basically mandates the requirements for managing the healthcare records and transactions. It chiefly concerns with the privacy and security of the PHI, which is the Protected Health Information. And PHI is typically used for patient identification and treatment. So it includes information such as the demographic data, their medical history, insurance details, and lab results. Healthcare is very private. A patient's health information is very private. And while technology providers like us can provide with solutions that can help these healthcare organizations meet the HIPAA compliance standards, but it is really up to the healthcare organizations ultimately for implementing these policies and procedures to ensure that these solutions are deployed in a very, very compliant way.
Yeah, and it's complex, isn't it? It's
yes.
process-oriented. Carsten, do you have thoughts?
Yeah. Let me add an outside view, let's say. As you might have all noticed in the meantime, I'm in Germany here, and we don't have HIPAA in Germany. Obviously, we have other rules about data protection and everything else, but we don't have a standard or a definition or rule set for the medical record as such, right? And the adoption of electronic health records or going paperless in the health industry in Germany is definitely behind, because there is a big now I signed myself up for a difficult word. Skepticism, is that the right word? So people are basically skeptic about having their records in electronic system, as there is not such a strong rule set like HIPAA is in the US, and that's definitely a blocker. So I think, as complex as it is, you in the US, we all in the US should be happy to have this rule set, and then from the technical side, I guess when you sign a HIPAA consent or something like that in electronic form, I think Debashri mentioned it before, with having the audit trail in electronic on an electronic signed document that says who touched the document, when and how and what for, and all this audit trail in there, and the documents are tamper-proof by encryption technology. Now here's the engineer, right? So by encryption technology and everything else around that, those records in the end can be much more secure than the good old paper record that just sits on the desk and falls on the desk, right? And then somebody else takes it. So therefore, I'm again encouraging. Go forward with it. It's actually a lot of benefits in there.
Great points, Carson. I will say it's funny, just speaking for myself as a patient, you sign in when you're going into a clinic for an appointment or whatever is happening if you're in the hospital. And it's very routine now. I mean, I've not heard of patients saying, I'm not going to sign the HIPAA waiver. It's just, kind of standard. Didi, do you have any thoughts about HIPAA at all? Oh, you're on mute.
Yeah, certainly, HIPAA becomes important as people move to the cloud, right? So now that you have your PII, your personal identifiable information, your personal health information, a lot of people are just concerned about breaches, right? And there's all this ransomware that happens now when people have access to those medical records, and now they can use that. They can use, healthcare organizations hostage. So there's a lot of, thinking that needs to go around protecting that information, and HIPAA certainly becomes even more important, right, as people move to the cloud.
Great, thank you so much. So let's talk about solutions. Let's start out again at 40,000 feet, and then we'll drill down a little bit. What are the core elements of ESign in healthcare? Carson, do you want to start out?
Obviously that's a variety of things, right? It could be like a long list, and especially if I would I would start to get very technical now, I could go on forever, but let me pick some. I'm saying some very important cornerstones for e-signing in healthcare is, and it's not in an order of importance, but just as examples, it's integration, it's obviously compliance, and it's the PHI or PII protection. Let me pick those three and talk a little bit more about that. So when it comes to integration, I mean, an eSign solution as part of, in the end, a HIPAA compliant EHR system obviously needs to be part of the system. And when you take a look at the market, most of these solutions out there are cloud-based solutions, and that is a good thing. But then these solutions out there just integrate with other cloud service, like with Dropbox or other kind of storage, right? You have to take a look at getting an e-signing solution that is actually 100% integratable, has an interface to work with your own quote-unquote file server, right? With your own EHR system. And you wouldn't be surprised if I say we support that. And that's definitely also a differentiating factor for our solution to have this file syncing mode. Another thing when it comes to integration, it's ease of use, right? When all of this is one system, it's much easier to use when you have to go from one system to the other. Every system looks different. So technical things that turn into real benefits is that an e-signing solution should be fully, how is that called? Fully customizable, so that it looks like your own system, like a part of your own system. That's a very important component that makes it much easier to. I could go on forever, but let me talk about the other part, the compliance part. Obviously, we talked about HIPAA compliance a lot already, and when you take an e-sign solution like ours and make it part of your system is not broken, right? Our solution as such is not HIPAA compliant. That's some kind of marketing that some companies do, but signatures is not even mentioned in HIPAA. But everything that is mentioned is data protection and so on. And our system obviously supports all of that. We as a company are SOC 2 certified, which is a very important part so that you can see that our processes are 100% data secure. And obviously we use the latest and greatest cloud technologies to be compliant with everything. So using our technology, using an e-sign solution from us doesn't break your HIPAA compliance at all. And with regards to PII protection, I just want to mention one thing. Now, and I touched a little bit on that already. Protecting those data in an e-sign solution like we have makes it actually a lot more robust and a lot more secure. So Foxit is known as a PDF company for many years, so we know that part, right? And your consent that you sign is in the end a PDF document together with a signature. And what does that signature? That signature, from a technology standpoint, means encryption. That means data protection in itself, right? That document is actually locked, right? Once you sign that document, it's so much locked that it cannot be changed. Even we as a vendor cannot go in that document again. The encryption is 100%, hands down, it's secured, right? And therefore it's tamper-proof. And on the other hand, it's fragile. So should somebody do something and change something, immediately it will be notified that this is not what the patient originally signed, right? So therefore, I guess the three components that I mentioned, integration, compliance, and the protection of the data are three cornerstones of an e-signing system in healthcare.
Great. And you teed it up perfectly for me. Let me ask you all, tell me the core elements of the Foxit e-sign solution. Debashri, would you like to begin?
Actually, Carsten mentioned really good points and really core elements for the e-sign in healthcare. And we know that e-sign in healthcare is like widely accepted as far back as 2004. They are legal in healthcare as long as they conform to the Uniform Electronic Transaction Act and eSign Act to make it HIPAA compliant and conform to these compliances. So just to sum it all, eSign systems must adhere to the requirements of properly authenticating the users, store the audit trail of the users, prevent any modification post-signature, and and the signed documents be able to be stored in a secure server. So just to sum it all, I think these are very high-level core elements of any e-sign requirements for healthcare.
Yeah, and let me add, because you asked about Foxit specifics in there, right? One thing I definitely want to mention is we have a system in there that is called templates, and that sounds simple, but that is a very important concept for e-sign in healthcare that we have implemented there. So think about maybe you all have once used an e-signing solution, right? So what you do is you have a document, you upload it to the signing solution, then you put all the fields in there, like party A signs here, party B signs there, and then you drag the date field and everything else in there. Then you send the document out, people sign out there, you get it back, done, right? Now think about that model when you, for instance, again, use the HIPAA concept that you have to sign a bazillion times, right? Every day, every patient. Therefore, we introduced this concept of templating. Right, and we can create documents in a way though that they are reusable. And again, HIPAA consent form is just the best example. You create it once for your organization, and then it's just there, so that it is not difficult for the staff signing on the patients or something like that have to go through a tedious process again and again. They just turn around the monitor and have the patient sign on that templated document that you can use every day. So just want to add that. Thank you.
Yeah, I also wanted to add, so also the benefit of working with, a company that has both an editor, a PDF editor, as well as a e-sign solution. The combination of the two is very powerful, right? Because now you can create those forms, and a lot of people start from Word and then they convert to a PDF or save as PDF. And then with one click within an editor, you can make all those fields fillable, right? I use that all the time because now I can just tab, and go through the form in an editor, right? Or as a reader, if you're using a PDF reader. Now, because if you work with a company that has both solutions, when you upload that to an e-sign solution such as Foxit, now all those fields are also fillable, right? You don't have to recreate all those boxes. There's a way you can assign who's going to fill out those initials, who's going to fill out the address, right? It's all there. You don't have to recreate all those boxes, all those check boxes, all those open text fields. So it's very powerful when you're working with a vendor that has both solutions. So I just wanted to add that as well.
That's wonderful. Thank you so much, Didi. So I want to ask a little bit about current events and the future. What have we learned in healthcare about this whole subject area in the context of the pandemic that we've been going through? And then I wanted to lead that into the future. But what have been any key learnings that any of you would like to share about ESign in the context of everything we've been going through the last 18 months?
Yeah, I'll take that first. So the global pandemic has reshaped the healthcare landscape, right, by accelerating the digital transformation. Today, patients are choosing, in vast numbers to avoid office visits, right? Therefore, healthcare practitioners have been compelled to roll out new experiences that safeguard their patients while maintaining viable, healthcare services. As a result, the newfound priorities for healthcare providers include maintaining patients, not losing on profit margins, and training and onboarding staff, right, for remote work. Healthcare heavily relies on documentation, right? Providers require intake forms, as Karsten mentioned, consent forms, you have to access the records, and many more documents like these. Since remote care has become a necessity, right, across the globe, a document productivity solution with an ESign solution, it's a requirement. Also, electronic documents can easily be shared and accessed remotely, as I mentioned before, right, in real time. The main goal with the document-based process during and after the pandemic is to provide, a number of things. Number one, contactless documentation by reducing the time, right, taken by patient intake and agreements while providing a safe and secure, contactless experience for both patients and internal healthcare departments. Number two, efficient data collection and record keeping, right, with centralized content repositories, easily accessible by all departments. Number three, the ability to update, track, and manage those documents becoming important, especially when you're doing audits, right, for HIPAA as well. Number four, allowing patients to book appointments and sign in from anywhere to, basically, again, improve the patient experience.
Yeah, I agree.
Yeah.
Didi almost mentioned it all, but the part is due to the pandemic, patients as well as the medical facilities try to limit the exposure time, the time you stay there, even the time, especially the time you wait there, the time it takes for signing in and stuff like that, right? So. In one occasion, I even had to fill in the intake form through a web page before I even go there, so that they save the 10 minutes or 5 minutes it takes at the front desk to fill in the form, right? And just want to mention, as you asked about what Foxit Sign Solution does, with our Sign Solution, you have a patient intake form as a PDF or as an electronic. It's just one click to turn it into a web form, and you can even sign it on the web if you like. Just want to mention. So the pandemic drives digital transformation and sparks off a whole lot of new creative idea to save time and effort. And in the end, it's also cost friendly.
Yeah, great points, actually, both Didi and Karsten. These are really amazing learnings from the pandemic, and the digital transformation is everyone can agree that it is the need of the hour for healthcare, especially. And the key to this, to have a sustainable digital success, is to focus on the initiatives that can actually, maximize the results while minimizing the effort and the cost within the organized healthcare industry. Shifting, this is something that I would like to say to the healthcare professionals and the healthcare IT leaders, is to shift your focus towards more scalable tools that can save your time, reduce the printing, reduce the burden on the healthcare employees, streamline their processes for most of the common daily workflows that involve documentations, that involve managing and archiving of patient records, or expediting the consent and approval processes, making the healthcare forms easier for the patients. All this will not just improve the patient experience during these times. It will also, most importantly, which is very important, is actually improve the employee experience and the internal productivity within healthcare. And this, in turn, all these benefits always help in improving the revenue within the healthcare industry.
Very well said. Thank you, Debashri. I would like to ask us, we only have 10 minutes now before we turn to questions. How do you all see the future of ESign and of electronic documents and documentation in healthcare in the next several years? What does it look like? It feels to me as though, and you've all shared so much wisdom here, it feels to me as though the landscape has been rewritten a little bit by the pandemic. It's shown us some of the weaknesses and the gaps in our system. And that, we all hate that there's a global pandemic, but there are little silver linings. And one seems to be, to my mind, a greater realization. We really do have to get away from paper. We've been saying this for decades in the United States, and you've all pointed out that our quote unquote paperless system is pretty paper-filled right now still. So what does the future look like? What do the next few years look like to you all?
Unfortunately, I think it's not going to be paperless, but it's paperless, but it's not like paper-free, right? It's less paper, but not paper-free.
It's paper, but not paperless, yeah.
Yeah. The adoption rate we're talking about electronic signatures here, right, is going to be much faster. I know mostly about our home market over here. We're behind, I guess, and we'll definitely catch up. It's just a requirement, as I mentioned in the very beginning, from a customer experience or a patient experience point of view, all the way to the cost savings that the companies can have. And I personally really believe in these solutions, and we see it already happening, and I guess it will only be accelerated during that times, right? When it comes to the signature itself, now it's my role as a technician here. I have to add something. Foxit is actively working in the community. We're a PDF company as well. We're working on the ISO standardization. We're working on the PDF Association, which is also looking into not only PDF, but also e-signatures. We're part of the Cloud Signature Consortium, which is another initiative where we work with. And from our point of view, today's e-signing solution are cloud-based solutions, and that is a good thing. That is something that works start to finish. But we think we can even do it better. So technically speaking, during the next some years, Foxit proposes and believes in turning a little bit away from the cloud-based approach to a more document-based approach, right? So the thought behind that is at this point, relevant information, like for instance, the audit trail, who signed when, where, who opened the document, and so on and so forth, is going into a vendor's cloud, right? That is good. It's safe there. Every time it's needed, we can go back there. It's definitely recorded properly there and everything else. But wouldn't it be good if that would be in the document itself? You sign the document, and therefore it should be in the document who signed it when and where, right? And in order to get there, we need extensions to the PDF ISO standard, not many, but some. And when we look at it from a technical point of view, this is where it's going. It's going to be document-centric and document-based e-signing so that it goes where it belongs, right? Your wet signature is in the document as well, and not on some storage.
Interesting. Thank you. Thank you for those insights, Karsten. Yeah. Didi and Debashri, your thoughts on the future?
Yeah, so That's a good point, Karsten. And we are involved in a lot of the committees, which is great. The way I see it is that there's three phases, right, to digital transformation, right? So the first phase is when you're digitizing documents from paper to a digital format, right? So having scanning technology and being able to compress the information and make it small, and also making it text searchable, right? That all becomes very important. The second phase that I see is digitalization. That's where now you're creating new workflows, and with the data in the document. So you might invoke another system, and there's a whole e-signing kind of falls in that category as well, right? Now you're moving more to the cloud. The third category is digital transformation, and it's really interesting how there's a lot of talk about embedding things within the document, but also extracting information from a document and also doing really interesting things with it, right? There's so much patient information. There's discussion about maybe AI technology taking that information and then predicting things in the future. So that's really, and it all starts by first digitizing your document, right? But the world is open, and this is how working with a document vendor such as us, a PDF vendor that is involved in a lot of these committees, and I know that Karsten is involved in the PDFA or the PDF Association. They talk a lot about this future phase of AI and where the world is going. So it's really beneficial to work with a vendor that really dedicates themselves to this space.
Wonderful. Thank you so much. And Debashri, any final thoughts on the future?
Yeah, so Didi mentioned a very good point about the wealth of information within these healthcare documents, which can be then, when they are in these electronic formats, they can be extracted and, can be utilized for, predicting and doing a lot of things with AI and predicting the patient care that can be provided. I think the future is very vast. It all depends on how the healthcare organizations can accelerate their processes and to adopt these electronic documentation processes and digitize a lot of their document workflows. The healthcare organizations do realize it, and they are adopting, and there has been a lot of acceptance for e-signatures already. And I think in the next several years, we will definitely see a very paper-light environment within healthcare.
I look forward to Paperlight. I think it'll be far better. And I'll just add one note myself. Everything that you've all shared, I absolutely affirm. I think that the next few years are going to be really genuinely interesting. I think that healthcare organizations, first of all, they can't afford the expense of paper anymore. So that's one element. Another is just all the processes that are already so complex. One of the things that we've learned during the pandemic is we have to simplify processes. We have to simplify the management of information. And everything that you've all spoken about speaks to that. We have to make, there's that silly red easy button commercial. We have to find the easy button in healthcare, and it's hard to find. But I agree with you. I think the future is bright. I think that there are so many smart people and smart organizations will get to at least paper-lite, paper-lite, and that will be very helpful to the healthcare system. So this has been such a fruitful discussion. I want to thank you all so much. Really, really interesting. I've learned a great deal. I'm sure that our participants have learned a great deal today. So thank you very much. And now we are going, absolutely, great to have you all. So now we are going to shift to questions. So thank you so much. We really appreciate all three of our presenters. And we've got some questions. So we've got a little bit of time for question and answer. So Didi, Debashri, and Karsten, I'm looking forward to your thoughts on these. So we have a question: how does FOXIT help with HIPAA concerns? And who would like to respond?
Yeah, maybe this is Karsten. Maybe I can take it. First, I think we mentioned some during the presentation. From a technical point of view, there's just no hurdle to integrate our solution and be HIPAA compliant. When it comes to more practical parts, obviously during the installation, during the implementation phase of our solution in your own HIPAA compliant environment, we are able and willing to and have to obviously sign a BAA, a so-called business associate agreement, that we need to let's say sign off on all the requirements that we take all the requirements for the data protection and everything else, and of course we give you that in writing. Yeah, no worries. We did it before.
Wonderful.
So no.
Wonderful. Thank you so much, Karsten. Another audience member asked, what level of encryption do you provide? So who would like to answer that?
Yeah, I can take that question. This is Debashri here. So yeah, Karsten actually did touch over some data for the encryption of data in the documents, but let me add some more information because we would like to know about the level of encryption. So we do provide encryption via password protection. So what that means is that behind the scenes, our solution employs a mathematical key to scramble the information in your PDF file. So it cannot be viewed unless the correct password is entered. Also, you can edit the permissions on the documents, and those permissions can be the edit, print, and copy, etc. Also, very technical information, we provide the 3 encryption algorithms, that is the 128-bit AES, 256-bit AES, and 128-bit ARC4 for more secure encryptions. And this is the most common question that we actually get from a lot of our customers about what are the encryption algorithms that we employ.
Great, Debashri. I really appreciate that. We have time for just a few more questions. So here's another one. The audience member asks, is your editor Section 508 compliant? Who would like to take that question?
Yeah, I'll take that one. Yeah, so making PDFs, it must be right. It must be readable by screen readers. This is for visually impaired people, and so our tool, our PDF editor, does provide the capability to make those PDFs into Section 508, which is a federal government requirement for the visually impaired. So the way we look at it, there's producing a PDF, right? And then there's also consuming a PDF. And the way it's usually consumed is through a screen reader called like JAWS. And so we've implemented both parts, of course. Producing a Section 508 compliant PDF is done through our tool. There's many things you have to think about. You have to tag the document appropriately for the different sections so that a screen reader can now read it. So yeah, we provide all that, and we also provide not only the ability to tag a document, but also check for compliance, and the compliance standard that we follow is VCAG.
Thank you so much, Didi. That explanation was great. We have a question that is kind of in the form of a comment from an audience member. One of the challenges with going paperless is that there is no one-size-fits-all. Organizations have to go through great lengths to determine a customized solution. Often the implementation part is not prioritized. Who would like to address that?
Yeah, that's a great comment, actually. So one of our U.S. healthcare providers actually came to us and wanted us to create an ROI, right, specifically for this case, right? How do you prove to management, to your business executives, that there's a need to move off of paper? And so they actually worked with us pretty closely, providing us data from the hospital on, how much paper they consume a year, and how many documents, et cetera, right? And so I did a lot of research with various marketing analysts, and there are studies out there, right, that indicate, to create a document, it's this much cost, right, including labor. There's this much cost if you lose a document. There's this much cost to file a document. There's this much cost for the floor space, right, for all that paper. And then there's, of course, when you're sending it for signatures, right, there's cost involved if you're sending over U.S. Postal Service, or it needs to be rushed, sent to, 2-day express. And then, of course, there's risks, right, with paper. I mean, I'm sure you guys use faxes, right? And this is what we hear many times from hospitals, is that they're faxing information from hospital to, specialty clinics, to other hospitals, and it all has private patient information, right? So now there's risks involved. Also, if there's floods, right? We heard from one of our customers in New York where there was the flood and all their papers were damaged, right? So I put together an ROI presentation and actually a spreadsheet. So if you like that, you can feel free to reach out to us, and you can plug in your own numbers on, basically there's a few things you need to fill in, how much paper you think you consume, and then it provides all the analysis for you and comes out with a ROI, a number that, this is how much you're spending with paper. So that's helped a lot of our healthcare organizations justify, right, that there's a need to move off of paper.
Wonderful. Thank you so much.
May I quickly add to that?
Sure.
Maybe it's my English, but maybe I understood another level of question in here by the person who's asking. I understood a little bit about often the implementation part is not prioritized. I mean, we have all seen IT systems being installed, and then the users were not trained and everything else, right? Or were not taken into the process, and then IT projects failed because they were not implemented right? Technically implemented correct, but not implemented into the organization, right? I can only speak for our solution, obviously, as a building block for a whole system going paperless, of course. But looking at our solution, you can get trainings. You can, for instance, just go to our website, foxit.com, and search around there a little bit, and you'll find excellent tutorial videos on how to use and how to apply and so on. I mean, that is not a fully organized change management, but just so that you get an impression on how easy it is to use and how we can support the implementation of our solution in your organization. Okay. Yeah.
I really appreciate that, Carson. We just have really 2 minutes left. One of our participants, attendees, asked this question, and I think I'll throw it to you, Carson, and ask you to narrow it however you would like to frame it. The attendee asks, you may have covered this, but what are the security arrangements? I know we've kind of been talking about security all along, but do you want to maybe summarize a couple of key elements, Carson?
Yeah, of course. I can do that. Try to be quick here to save the time. Debauchery, just at the very first question in this list, I guess, mentioned all the levels of technical security in terms of how do we protect the data? How do we encrypt it? And I'm not sure you can repeat all those acronyms. I could, but I'm not going to, because you can keep in mind just the latest and greatest, right, in data security encryption. Second thing, to be quick here, is secure logins and identity checking in this sense is built into our solutions. Third thing is very important as a layer of security is the cloud technology that we're using, from login to storage to making sure that it's intrusion protected and everything else. And for the sake of time, I can just tell you we're using the latest and greatest technology here in cloud tech. And last but not least, somebody is afraid of storing your signed document in our cloud. I mentioned it during the presentation or during the discussion. We do have this fantastic interface in our software that allows you to store your documents in your local systems rather than keeping it in our cloud forever, right? So that is another layer of security where you can take it in your own hands once the document is signed and approved, and you just take it out of there and keep it in your own system. Okay.
Wonderful. Thank you so much, Carson. And someone just wanted to leave this comment, and they write, "You guys are awesome. These are all the discussions we've had in our office. Appreciate all the information." I couldn't have said it better myself. We've run out of time, but Debashri, Didi, and Carson, thank you all so much. This has been a great session. I know we've learned a lot.
Thanks for
Thank
having
you so much. Thank you very much for having us. Thank you.
Thank you all very much. So this concludes